like to welcome you to the first annual Supply Chain Summit organized by RKSM. The whole idea is to see states coming in, sharing their experiences, some of them especially Yobe and Kano. And so we're basically looking at those states, showing exactly what it is, what the journey has meant to them. And then states like Kaduna, Nasarawa, Niger, coming in to, tell everyone else what the journey they have embarked on. They have been implemented to the work plan for about a year plus now. And then for states like Borno and Bauchi, Gombe are just coming on board, know exactly what to expect. The positioning of state DMAs to the stronger supply chain is essential for universal health coverage, which is the main drive of the country and of course the world at large. Now RKSM has been working with these states to build their supply chain capacity.
Yes, so it has been a successful summit, and one of the key takeaways, it would be nice for participants to go home with is one, teamwork, for them to have a work plan that will help them to have focus, that will have the KPIs for them to be, measured on whether they are on the right track and direction for the necessary outputs and outcomes, and at the end of the day, very, very impactful healthcare outcomes for the populace.
We reflected on our 2 years plan, and we have interacted with other states that also took part in this summit. We have learned a lot from them, which we will use to see that we improve our processes.
Specifically, I think we learned from Kano that it's possible to actually reduce our lead time to dispatch from the facilities to the facilities. So these are some of the takeaways that we have, that we'll see how we can improve the processes in Yobe State Drugs and Medical Consumables Management Agency.
So we're looking at putting all of this together as we begin to focus as we go into the next year for more states to embark on this journey and leverage on these private sector competencies that we're trying to bring into their supply chain.
The plan is to deepen engagement and also widen the reach in terms of helping the states and the DMAs achieve their supply chain goals. We will be working closely with the state DMAs, working closely with the warehouses, central warehouses. In some states, it will be us scaling operations, reaching out also to deploying horizontally for some states where they have central warehouses and zones. And also for the health facilities, we're also looking at scaling in terms of faster turnaround time, increase in footfall, accessibility to healthcare services, and also improving customer satisfaction for the patients, reducing waiting times and all that. So those are some of the things we would be focusing on.
At the moment, we have a total of 8 states we are supporting, and the focus of our support is to strengthen the capability of public health entities that are involved in the procurement of medicines, medical consumables, and equipment. And by strengthening their capability is for it to translate to availability of medicines, medical consumables, equipment, as well as affordability.
By 2024, we want to see more states that have evolved to that point where they are fully emerged and ready to integrate other programs. We want also to see that these states are being more intentional in their approach to supply chain activities in the states. They are taking ownership, and they are beginning to draw down more on the private sector partnerships made available to them.
Supply chain!